one of the best things you could do is face your fear. Because when you face that fear, it no longer has power over you. It can't bully you anymore. And I think people, with anxiety, there's a lot of avoidance. You doing the inner work will change your outer world. I wish people really got that. I think a lot of times people are thinking about changing all the people around them or their job or whatever, but sometimes what needs to happen is within you, and then everything around you will change accordingly because you're a different person.
Yeah, you can't help anything else until you help yourself. Welcome to the Healing Lab podcast. Today we have Elizabeth Ssemanda, who's a holistic psychiatrist, and she specializes in anxiety, mood disorders, and trauma. And she has been trained at Brown University and Johns Hopkins. Elizabeth, thanks so much for joining me today. How are you? Wonderful, wonderful. I'm really excited about our talk. There's just so much going on with people being anxious and having all kinds of mental health issues these days. What is your approach that you have found most effective dealing with these people, specifically for like non-invasive therapies or approaches or habits? What do you find has been the most effective for your patients?
I think that, usually there's a reason for anxiety. And I like getting to the cause of it. Like, what is the root cause of anxiety? And then I also believe in talking to the person and tailoring my approach to them, because I think that there are many ways of dealing with anxiety. There's so many different types of treatment. There's cognitive behavioral therapy. There's like something called ACT, acceptance and commitment therapy. There are mindfulness based techniques, and then even for anxiety, there's so I was talking about the different types of therapies. There's somatic therapy, because a lot of times, so depending on the cause, you might tailor, and the person, right? You would tailor the approach, because some people have done a lot of thinking about or look a lot of the cognitive approaches, and sometimes maybe that didn't work for them, and so you might want to do more somatic types where you actually have to move your body. And then there are different ways of activating the part of our nervous system, the parasympathetic nervous system, where we feel more relaxed. And so we can do that through different types of movement. So various yoga poses, there are different things like qigong exercises. There are different acupuncture points. So I think I like to tailor it to the person, and see where they're coming from, see what they've done before, and then also what they're open to.
I actually came up with this idea, which has to do with just kind of, taking control of anxiety and kind of what you're saying of, different methods to kind of calm, your anxiety without taking prescription medication. And about like the vagus nerve and,
Yes.
monks and like Buddha, like they, it's part of like a, breath work and then also,
Yes.
you know, relieving the vagus nerve. So I, as an inventor, came up. I was like, okay, they should have a massage thing like that's like a disc, like a about that you could hold in your hand, and it massages, and you can put it right on your vagus nerve, and because that actually can have an immediate, like pretty immediate effect within 5 minutes of like calming yourself down. And it actually did exist. So I go in on Amazon and there's one there, but it was like $250 marked down from 280. And it was, I don't know why it was so expensive, but they only had one
Wow.
of these like vagus nerve massager type things. They have another one that's electrical shock that you like shock in your below your ear that also supposed to hit the vagus nerve. But do you ever work with that with any patients, or what do you think about that? Because I've tested it out personally, and I mean, it's worked out. Actually, it works pretty good.
Well, yeah, that is an intervention. Like and I talked about acupuncture and acupressure points. Yeah. And even within the field of psychiatry, we talk about there's a type of psychiatry or psychology called like energy psychology, or you may have also heard of like emotion freedom technique, where we tap on different points within, on the body in order to, I guess we do a couple things, right? Sometimes it's for release, but we can tap on particular places within the body to activate like the vagus or the parasympathetic system. So exactly what you're
Hmm.
doing with what you invented. So I guess, it's really, so kudos to you. Like another thing people can do before reaching for that Xanax. I'll say this, like when you're able to have like a skill or something that you actively do, it's very empowering, because then, if you do encounter anxiety, you're not going to be, I've seen a lot of people do lots of things with anxiety, but it's not going to bully you, and it's not going to keep you from living the life that you
You'll be
truly
able
want to
to
live.
control it. You'll have the tools and the protocols to kind of control it better than if you didn't have any tools or knowledge of how to manage it,
Absolutely.
basically.
Absolutely. Absolutely.
Great. Um, so how deep do you get in with your patients about sleep? Because what I've read or heard somewhere is that if you're dealing with somebody that has major, whatever it is, the mood disorders, depression, anxiety, trauma, maybe even drug addiction or something like this,
Yeah.
like that, a lot of the psychiatrists, or I think this is a good thing to do, but they recommend, just having a habit of going to bed on a decent time and waking up at like a normal time consistently every day can actually make like a profound impact by just changing your sleep schedule, and then, you know, go just basically getting like a lot of times I think it's prescribed, they'll prescribe like sleeping pills that kind of help you get to bed early at a normal hour. And
Yes.
then it basically kind of can reset your, a lot of different things, not everything. But what is your approach on that, on sleep specifically?
Yeah, I agree with you that it's good to have a consistent bedtime, and consistent for you. I believe in listening to your body, because I think, um, people get so married to like this 7 to 9, like I need to have 7 to 9 hours of sleep. And when they don't get, everyone is different, right? There's some people who 6.5, like they function well on that. And there's some people who need like a solid 10. But having a consistent schedule is important. What you're talking about is like like basic sleep hygiene. So things like, we have our screens, we've got our phones, and having a wind down period where we don't look at our phones, and even, the screens. Like there's some people who have TVs in their bedrooms that will kill sleep. The other thing that I'll say that I might touch a couple nerves is like, I'm a pet lover, but sometimes some sometimes like your pets can get interfere with your sleep. So I think that with sleep, like kind of like with anxiety, I believe in getting at the root cause, because sometimes, um like with things, when we look at some of these psychiatric diagnoses, like depression, anxiety, like sleep problems is one of the criteria, right? So we have to understand what exactly is going on, and then we can target, the true cause of what that is. But having great sleep hygiene, So those things that I talked about before, as well as things like making sure your bed is just for like sleep and sex and not other things, and then also being very mindful about the temperature because we are really sensitive. I know in Texas it gets really hot, and when it's hot, it can be very difficult to sleep. So keeping that thermostat between 65 to like 68 degrees Fahrenheit, like a lot of people
That's
find
pretty
that to be
cold.
really comfortable. Um,
Hmm.
and and then I do believe that um, caffeine is a huge thing. Like I will say this. I love my coffee. Love it. But when having it after 3 p.m. can like mess with your sleep architecture. Having it period can too. So there are a lot of things that have caffeine, like a lot of energy drinks. And even
Hmm.
chocolate has caffeine. And even decaf coffee has a little like this little bit. So you need to know you. You need to know you and listen to your body. And some people, would take it even further. Like we need to start living in accordance to um, like nature and the seasons and that sort of thing. So, so yeah, I think that with sleep, one of the best things that we can do is connect with our body and really listen to it.
Yeah, so my philosophy with that is, try to get to bed like not too late, and then I just sleep however long I want to sleep, and then I wake up. But I don't go to bed like super late, so I'm not gonna wake up like super late. But it's just if I need to sleep an extra hour, I can give my body that time, and if I'm awake, I'm awake. But like reverse engineer the alarm of like instead of having an alarm to get up, you should only have an alarm to go to sleep, and then you wake up whenever you wake up because that's how much your body needs.
Yeah. Yeah. If you have that, yeah, I think, yeah, you're listening to your body. And I wish that more people would do that. I think that sometimes people try and just they really are like fighting themselves. Like really fighting we all have our an intrinsic circadian rhythm within ourselves. And unfortunately a lot of times we may not listen to it. So I'm glad you listened to
So
yours.
yeah. So how detrimental do you think untreated sleep apnea or untreated snoring is, specifically like if you had any experience or with your patients or just typically with people that you deal with, to where if they are not getting good sleep due to constructed airways, then they're not getting enough oxygen and they're not going to get deep REM sleep, and they could have like potentially hundreds of these little tiny mini strokes throughout the night. Have you experienced that with any of your patients, or have kind of,
Yes.
so
Yes.
look, if you're even getting on the CPAP machine, like let's say you're like having a hard time, you're always tired, you're just in a bad mood, you're gaining weight, you blah, 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 all this bad stuff's happening. It's like, okay, like now you have the Da Vinci pillow, right, which is a non-invasive tool that stops snoring because it opens up your airways 100%. But it doesn't work for everyone for sleep apnea. Some people still need the CPAP machine, but I mean,
Mhm.
taking someone from like not using the CPAP machine to using it and then having a big transformation, like, wow, I'm getting like a lot more, sleep, better oxygen, deeper sleep, longer sleep, because I can actually breathe. Because if you're going out decades, like imagine 3 decades of like not untreated like sleep apnea or snoring, like the lack of oxygen you get in your brain adds up significantly over time and
Yeah.
progressively gets worse, right? And
Yeah.
then that can lead to a major stroke, and it just can lead to a bunch of other bad things. um
Yeah.
so Yeah. So what are your thoughts on that and helping people kind of navigate sleep in that way?
Well, a couple things. So, a lot of times I might be the person that diagnoses sleep apnea because people that are, um, a lot of people will come to see me because they feel depressed, right? And sleep apnea can look like untreated sleep apnea can look like depression. And
Yeah.
and once it's treated, it will change everybody's lives. Because a lot of times, you said one of the biggest symptoms that happens with sleep apnea, and that's snoring. The like they are like if you have a partner and they you can hear their snoring in the other room, that's an indication that they probably should get screened for sleep apnea. But a lot of times it looks like depression. They're falling asleep, like sometimes even while driving people will fall asleep. Um and and so taking the steps to get, first of all, have a good evaluation. They go to a sleep study, and then talking about the different interventions. So your pillow is one, but the other things, a lot of times, sometimes, that when things are actually treated, right? So whether it's them losing the weight, whether it's, I think you can have a dental procedure that you can also do. But like, I what I love about your pillow is it's non-invasive, and it's something else that people can do. Because some people, there's the BiPAP, the CPAP, those machines, but sometimes getting them might be a bit of a hurdle. Um, and and so it's good for people to have different types of options. But it is almost, people are so happy, they feel like usually they're coming to me, they're thinking they're just depressed. But if we find out it's like secondary to obstructive sleep apnea, and it actually gets treated, it's like a whole new person. And
Mm.
usually, because they've been snoring up a storm, like, their partner's a lot happier too, because they can actually
Oh, yeah.
sleep as well.
Yeah. So there's a lot of talk and just a lot of new um, research that's been going on with psychedelics for trauma and antidepressant, um, you know, from psychedelics that like have antidepressant properties. So, what are your thoughts? Because if you go around now, California, they got ketamine clinics on like every corner, pretty much like all over the place.
Yes.
And now like psilocybin mushrooms, magic mushrooms are pretty much legal across the board, and those have been, from some reports that I've seen, like they now have scientific kind of proof of how it can help somebody like reconfigure their brain and neurotransmitters to help deal with depression and anxiety. Um, what are your thoughts on that? And also like with the ketamine too, it's like the whole point of that is kind of taking a out of body experience if you were dealing with trauma, just so you see yourself in the third person as like not you, and then you can process it, kind of like the family systems therapy. I'm not too familiar with that, but I think it's like the
IFS,
same
yes,
idea where it's like there's,
IFS.
yeah. So yeah, what are you involved in any of that research or anything, or what do you think about that?
I think it's a great time to be. So I am connected with that. I think it's a great time to be in psychiatry right now, because some of these things have been they've been here for some time, right? Like psilocybin, and uh, I mean, there have been psychedelics around, like indigenous communities have been using it for quite some time. They're not
Yeah,
new,
century.
but I think that um it's important to really be mindful about state laws, like what's in the United States. There are only specific states where this is legally able to be used, um, I think that they can be incredibly, like when you look at the data and some of the trials coming out, it's very promising because I think what it does, or what I've seen it do, is sometimes we get stuck in a loop, right? Like we're in the depression loop, and we've been in that loop for so long. It kind of like maybe might break it long enough so that you can have what you just described, that higher perspective. And what's really important, when I think what people are forgetting, is that there has to be something that comes after that, right? You know,
Mhm.
you got to do some work. There's like some integration, talk to a good therapist, or like maybe make some life changes. I think it's not enough just to do that. It might help break things up for a little bit, but there's got to be something else. So I'm a big believer in like post um post psychedelic integration therapy, and then even pre, like getting ready for it, like all the things that need to happen, because I think that people have different experiences. For some people it really is like a breakthrough. For other people might go and have a not so positive experience. But going in knowing all the risks, all the benefits, and looking into yourself and working with your medical team to really have a good understanding of whether this is appropriate for you given your situation. But I think in the field of psychiatry and in human evolution, as far as consciousness is concerned, I think there are a lot of wonderful possibilities if we are able to do this in a thoughtful and ethical way.
Mhm.
Yeah.
And then also an add-on question, which I'm very curious about as well, is that a lot of people who've gone to therapists or I've seen on YouTube or something like that, and they're looking at like
Yes.
inner child work and like things that have happened in the childhood, and like how do you go about, you know, finding that? Because it's like, oh, I needed to like I was like for like one of these guys I know from work, he was like super scared to fly. Like he wouldn't fly anywhere, and he missed out on like a lot because he has a massive company that makes a ton of money, and he wouldn't fly. And he basically was able to track that back down to when he was like 5 years old and flying on a plane with his dad, and his dad was like so scared that it just kind of like got into his brain that planes are just unsafe, and it was just like he was like dreadfully scared to even go on a plane and literally wouldn't even fly until he did like this inner work with a psychiatrist and therapist to like uncover that. But is there a process that you use to kind of do that? And like I assume like anyone in the world would have these types of some types of issues that would kind of come about, right? I mean,
Yeah.
do you deal with that kind of stuff? What?
Yeah, well, I'll say this. There are different types of anxiety, right? There's generalized anxiety, so when people worry about lots of different things. There's social anxiety, when people are they're concerned about, a lot of times they're really concerned about what other people think. May have trouble with presentations. There are, so I think it's important to know the type of anxiety, because then we tailor the treatment based on what that type is, and then also what people are willing to do. Like I'll say this, right? Like one of the best, or um and their phobias, right? So people like being afraid of flying, right? That might be one of them. So um yeah, there are many treatments available, but are people going to be willing to do, some treatments may be available, but people may not be willing to do them. like may work really well. Like first, a lot of times I'll say this for anxiety, one of the best things you could do is face your fear. Because when you face that fear, it no longer has power over you. Like it is so it can't bully you anymore. And I think people,
Mm-hmm.
with anxiety, there's a lot of avoidance. Um, so I like when I work with people, I'll give people options. I'll say, hey, social anxiety, you could do cognitive behavioral therapy for social anxiety. We could come up with a list of things you want to do socially that you like to be able to do from like easiest to hardest. We'll go down that list. Or for generalized anxiety, right? Like what I like to teach people is things that are actually going to help them regulate their nervous system, so or activate their parasympathetic nervous system. I do think breath work is so powerful because breath is life. And a lot of times when people have anxiety, they're breathing really shallow. And
Mm-hmm.
so diaphragmatic breathing can be helpful. And there are different types. There are people, some people do box breathing. A lot of times um, when you lengthen the exhale, it can be really helpful depending on what you're trying to do. I do think though that there are some contraindications to breath work, like that for some people, like especially if you have a history of respiratory illness, or like there are some people, or if someone has like a prior diagnosis of like bipolar disorder, or um, has had a psychotic disorder, they may, I think you have to be a little bit careful as far as breath work is concerned because it can trigger some things. But, and if someone has had some cardiac issues. So I think um, there are many tools. I believe in sovereignty. And I believe that a lot of times when people come to me, they know themselves better than anyone else. I'm stepping in. I'm stepping in. I'm here to be helpful. But they know themselves. uh and the last thing, I think you did talk about meditation. I'm a huge fan of meditation, and primarily because I think that we in this society, we're always like go go go, we're always do do do. And there is a part of us.
Yeah, it also can help you kind of live in the present moment too. So you're not, so if you practice living in the present, then you're not worried about what happened yesterday, right? Or a year ago or 10 years ago. And you're not worried
Yes,
about what's going on tomorrow and worrying about problems that 90% of these problems that people worry about just kind of go away. So it's kind of like worrying about nothing, you know?
absolutely.
Yeah.
Absolutely. I
So,
think
mhm.
I was just going to say that um I think someone did a study like when are people really happy, and it's when they're in the present moment, when they are here in the now. And
Mhm.
when people are in the past, they tend to be down, depressed. When people are in the future, they tend to be more anxious. So learning to be here, learning to appreciate what's in front of you, and having that spirit of gratitude can do wonders.
Have you do you have any experience with any like colleagues or actual patients that you worked with that actually did like a ketamine treatment therapy
Yeah.
where they basically, tried to, it's create an out of body experience, and then what were the results of
Yes, ketamine can give a lot of people an out of body experience. And sometimes it's when some of us are just so in our story, right? And it'll help kind of, allow us to be more open to what's going on in the now, right? So there's a lot of possibility, like especially if you have a therapist there, while, like, during this, to help. Like, there's psychedelic assisted therapy. I guess, is that what you're alluding to? Like, that can actually
Yeah.
be helpful for people who've got
Hmm.
walls, and we all have a lot of, like, especially if you have a history of trauma, and it can be very, sometimes the progress in therapy can be a little slow because it may be tough to, or you may not, open up and talk about things, some of the things that you really need to talk about, or some of the things you need to focus on. So this is just, it's an avenue for maybe getting at some things that might be harder to get at. But it's not the only, like, I don't want people to think, because I've seen powerful things happen with breath, like the right type of breath work, and even meditation. I think anytime you can take time to work on you doing the inner work will change your world. I wish people really got that. Like, if I think a lot of times people are thinking about changing all the people around them or their job or whatever, but sometimes what needs to happen is within you, and then everything around you will change accordingly because you're a different person.
Yeah. Yeah. You can't help anything else until you help yourself. Do, do you work with any breath like practices? Like one time I went to this breath work class and it was like an hour long. And then for 45, we like did this like hyper breathing for like 45 minutes. But after about 5 minutes, you kind of get into this like totally, it produces DMT naturally in your brain. And
Yes.
then you basically are like all like it's crazy, right? It's like woo, you know. do you
Yeah.
do you ever yeah work with that at all or?
So there is a type of breath work called, like, holotropic. I mean, you might, so there are different types of breath work, but like holotropic breath work is almost like, is akin to, that's why I'm saying, like, you can go, and I'm not knocking psychedelics. I think that they can be helpful, but um you can get into different states with breath, with your breath, right? Just breathing a
And
particular way. So
meditation and
yes,
meditation.
and meditation.
Yeah.
Yes. Um so yeah, I just want people to know that there are lots of options, and it's really, what are you willing to do? Go ahead.
Yeah, and like a main component of that is going back to the sleep issue is like if you're not getting a good night's sleep or if you do have sleep apnea that's not treated and you're just that's going to lead to an array of problems that are going to progressively get worse, which is that's why like one of the reasons why I'm so excited about the Da Vinci pillow, which is the pillow I invented, because it's actually the only pillow in the world that actually effectively stops snoring. And it's the only pillow that actually lifts your chest up in a certain way that puts you in a CPR position. So your throat is like your head's tilted back, your chest is up, and then your throat's so it basically makes it very easy to breathe. So you're getting like way more oxygen than you would laying on a regular pillow. And then if you are dealing with anything like snoring or sleep apnea, um, it can help significantly with that and potentially get you off of the CPAP machine if you have the right posture and able to like maintain that posture throughout the night. Um, posture issues can actually cause snoring and sleep apnea where you're kind of
Oh,
like,
absolutely.
kinking your airways and stuff.
That is very,
So, yeah.
very true. That is very, very true. I think that's why it's just important for people to have options. I do like your pillow, and it's particular. I just like for people to have options, because I do see people really suffering with sleep apnea, and we do tell them, like, when we do work with them, we talk to them about position. So if your pillow is something that can at least help people, align in a way that keeps their airways open, like it'll make for better sleep. And
It's already
yeah,
changed so many people's lives. Like literally, this. I know this one guy. I mean, he had two surgeries and a mouth guard and snored, and then he tried the pillow. He didn't snore one time, but before, him and his girlfriend were like not kind of like doing all that well. It was just getting worse and worse and worse because he wasn't able to sleep in the same bedroom because he snored so loud, and then he
yeah,
was tired all day, gained weight, and then he got on the pillow and didn't snore once since. And now his relationship's really good. He's lost weight. He's has energy throughout the day. I
yeah,
mean, it's surprising. People underestimate what a actual good sleep with a good pillow that actually positions you and supports you in the right way can have on your entire life. Is absolutely, I mean, if just think about it, if you're getting 20% more oxygen into your brain for 8 hours a day over decades, that's a lot more oxygen than having it depleted in your brain and